Bex has been around for a while. She's a paramedic at Medway Station, and Robin at the time was a student paramedic, associate practitioner route, who's been with the Trust for a while now, but he's since qualified as a paramedic. Bex and Robin were called out to a caravan park in All Hallows. A gentleman had been using a disc cutter. We believe he'd put on an oversized blade and taken off the safety guard, and as he went to cut a metal pole, the disc cutter rebounded, the disc flew off and then caused a number of injuries to him. Initially, when Bex and Robin got there, they were presented with someone who was very agitated, in an awful lot of pain, who was bleeding profusely from wounds to his cheek and also from his chest. So the call was located in a fairly remote part of the Medway dispatch area, quite far away from help. So it must have taken them a while to get there. When they got there, they asked for early support, which is always key in these circumstances, you know, not to manage these things alone. They utilised the bystanders, which I think made a difference as well. It also assisted them in moving the patient to somewhere safe. They were in quite a confined location. It was inside a caravan. The patient's blood pressure was very low, and they rapidly gained IV access to both arms, so bilaterally, in order to be able to give fluids and help boost blood pressure, as well as giving some vital pain relief because the patient was in so much pain. I think, you know, certainly they utilised the bystanders that were present. One of them, fortunately, was medically trained in the army, so that helped an awful lot. And the main thing was to, first of all, control the potential airway compromise with the bleeding. He had a laceration from his cheek all the way down to his jaw, and that opened up to bone as well and was a complete flap and actively bleeding at the time. So the first thing was to control the bleeding there, make sure that the airway was protected. Patient was still conscious, so we couldn't do any airway interventions other than help manoeuvre and drain posturally. And then I think, you know, it's not every day that you see a fist-sized cavity in someone's chest, and certainly not with splinters and shards of rib around as well. That was actively bleeding too, so I think that must have been quite shocking for them initially when they saw it. Although I don't know the outcome of the patient at this time, I'm very confident and absolutely certain that Robin and Bex gave the patient the best possible chances of survival and to minimise the life-changing injuries that could occur.